Bipolar disorder is a mental health condition that affects 45 million people worldwide. Now, every year, the 30th of March is observed as World Bipolar Day to bring awareness and to promote proper medical treatment for bipolar disorder. Now, bipolar disorder affects a person's mood and energy levels. Now, imagine your emotions are like an absolute roller coaster. With bipolar disorder, someone's mood can swing between the two extremes. Feeling really high and energetic, called mania, and feeling very low and sad, called depression. Now, during the manic phase, a person might feel overly excited, have lots of energy, and do risky things without thinking about the consequences. They might talk really fast, have trouble sleeping, and feel like they can do just anything. But then, they might crash into a depressive episode. Now, during this time, they may feel hopeless, lose interest in things they used to enjoy, have trouble sleeping or oversleep, and feel very tired or even physically sick. Bipolar disorder can make it hard for someone to manage their daily life, like going to work or school, taking care of themselves and maintaining relationships. But with the proper treatment like therapy and medication, many people with bipolar disorder can manage their symptoms and lead fulfilling lives. We are visiting psychiatrist Dr. Sibongile Mpongwana-Ncetani at the Life Path Health West Beach Clinic in Cape Town today to find out more about supporting a loved one with bipolar disorder.
Hello Rocco, thank you so much for inviting me here today. Like you said, I am Dr. Sibongile Mpongwana-Ncetani and I'm one of the psychiatrists here in West Beach Clinic. And I am really looking forward to having a conversation today about bipolar, helping empower the people and those who might be walking and journeying with this disorder.
So Dr. Sibongile, how can we help or support a loved one with bipolar disorder?
That's such a brilliant question because I think a lot of time in clinical practice, I've been in state practice now and also private, you find that a lot of people sort of feel paralyzed in that they don't know what to do. So these people are often called caregivers. It can be the parents, it can be a sister, it can be a grandparent who's helping look after someone who has a diagnosis of bipolar 1 disorder. And I think the first thing really is to be aware of what the disorder is and how it manifests. So if you are someone who is a designated caregiver, you must also educate yourself about the disorder and know what are the telltale signs for early relapse. And I'll just give 3 things. Sleep is very important for people with bipolar disorder. So if you see that they are not sleeping well, they're getting up at night, they're quite busy, then that should warn you that, okay, we think relapse is coming. Energy levels, if they seem to have more energy levels than required, then you might think, okay, relapse is probably coming. You must also look at things like appetite. If it's increased or if it's too low, then you might think, okay, relapse might be coming. And if they get to, be involved in everything and anything, and you see that there's no structure in how they're doing things. I recently had a patient who was more impulsive, where she would go running, because she usually goes running, but now Rocco, she was going running at night. So putting herself in danger. So her family was like, oh, but she's just going jogging, but now she's jogging at night. So we call that then quite impulsive because there's no thinking around that. So educating yourself around the disorder and being able to tell all of the early relapse signs would be very important. So that's how they could know.
Then we're moving on to question number 2. How do doctors usually help people with bipolar disorder? And do the treatments work?
Okay, I love that question. I'll start with the second part. The treatments do work. Yes, the treatments do work, and please come get a treatment. So as a psychiatrist, so for instance, if we go back to this picture I gave you of someone who's having an early relapse, and what you do, you'll probably, the first point of contact, Rocco, will be that they'll go to a general practitioner, your family doctor, right, or your clinic. that is in your community. And there, where they see and they suspect that, they will refer you to a psychiatrist. Now, the psychiatrist is the one who should be treating bipolar disorder and who makes the diagnosis and who gives the medication. And usually we give things like antipsychotics and mood stabilizers. So people will be like, ooh, antipsychotic. I am not psychotic. So bipolar is a very it's a varied disease. Like, it presents in so many different ways, Rocco. So you have different episodes where you can have the highs or the lows. The highs we call the manic episode. This is what I talked about. High energy, you impulsive, you talkative, you have so many ideas, and you are even grandiose. Like, you think you are the best thing that has happened in the world. And actually patients enjoy being in that high state because you generally feel good. If you get around those people, usually their mood is called infective because you also leave there feel like, oh, okay, So what then happens is that with that episode, and you are seeing that it's not just normal happiness, because usually they will even neglect their responsibilities, work, school, and that's why we call it a disorder. And then if they are in the low, the depression, what they do is that they present with low mood, also not sleeping well, they don't want to do anything, and often they can also feel suicidal, right? So those two things, the highs and the lows, will make up your bipolar. And then for me, I will give you an antipsychotic which will be working as a mood stabilizer, but also in that high you can be grandiose. So ideas that are out of this world, they are fixed, false beliefs about yourself. And that's where the antipsychotic works. And we talk about an acute episode treatment and a maintenance treatment. So when you come to me, my acute episode treatment would definitely be giving you that antipsychotic, be it Alexa or olanzapine. There's different kinds, and it will also depend on how you are presenting and what, so it's not like one size fits all. There's many in the cupboard, and then we look at how you're presenting, and then we give you that. And then we also give a mood stabilizer, something like lithium, which has been called a gold standard. So maybe people will know about it. Maybe your family is on Camcolate, which is what we use. So maybe someone is on Epilim, which is what we use to stabilize the mood, right? Because we don't want highs. We don't want lows. We want you to be here in the middle. So in the acute phase, we do that. And that's when people are admitted in hospital, because bipolar is one of the serious mental disorders, right? And because it's a serious mental disorder, we cannot just say, oh, we'll treat it at home.
So when should someone with bipolar disorder seek help or visit their psychiatrist?
I know professional friends who have bipolar. I've treated professional CAs, doctors, lawyers who have bipolar. And the beautiful thing is that in that episode, you get that medication, you can go back to your baseline function. You can go back to work. So that's why it's important. You don't ever stay home with bipolar. You don't ever stay home with someone you're like, I think I might be having an episode, because it's episodic, right? If you see that you're having one, contact your doctor immediately, because it's something that can be treated. And you know why it's also important to contact your doctor early? Because the longer you are in an episode, the worse it is, the harder it is for you to go back to your baseline function. And the worse is your outcome, right? Your outcome is going to be poorer if you continue with a bipolar in a manic episode or a depressive episode, and you continue in that not treated. So it's just another reason to say, hey, visit your doctor, the sooner the better.
And this brings us to the last question, doctor. Can people with bipolar disorder do anything in their daily life to feel better or to cope better?
I love that question, because it speaks to the preventative aspect, right? How do I prevent these episodes from coming? How do I prevent going back to hospital? And because I'm a psychiatrist, we love our medication because it helps the chemicals to balance in your brain. The first thing I would say, stay on your medication. Don't get off your medication unless you have discussed it with your doctor and you have looked at the advantages and disadvantages of being on medication. And with bipolar, often the medication, you are going to take it indefinitely. That means like there isn't a set date which to say, okay, we're going to stop because of the seriousness of the illness. But as you continue seeing your psychiatrist, you may reduce the medication based on how you are presenting as you work with your psychiatrist, but it will not be by yourself. So please don't go off medication by yourself, because that can be very dangerous with the medication we're taking. So number one, stay on your medication, get yourself a good routine, right? Routine is very important with people living with bipolar, because in the episode you can be quite erratic and impulsive and all over the place. And so when you have a routine, I wake up at this time, I go to sleep at this time, very important, going to sleep at the same time, it contains you, right? So, and upon waking up, I brush my teeth and I take my medication. So you're getting into these healthy habits. So getting into a nice healthy routine. And then the third thing I would say, nutrition. Very important. Like, it's important for all of us. Getting the right stuff in. Remember, bipolar is a brain disease. So you need to feed that brain, okay? So you need to feed it the right stuff. So there isn't like a bipolar disorder diet. No, there isn't. But it's just a nice balanced diet with your carbs, your proteins in there, and your veg and your fruits. Just the right amount, right? And then the fourth things will be exercise. I mean, it's been proven, a lot of studies, how exercise helps with managing your mental health. Often you find that between episodes in bipolar, people have a lot of anxiety. And it makes sense, Rocco, right? Because someone is thinking, oh, I don't want to get sick again, or will I stay well, And even the episode itself can be quite traumatic to people who have the episode, but also the people around them, right? So getting into exercise and managing those anxiety levels is very, very important. You can do running if that's fine for you. You can do weights if that's fine for you in gym. And the fifth thing would be good social support. So often, a lot of people, there's these highs and lows, right, with bipolar, but most of the time people present with depression, so in the lows. And one thing we know about depressive episodes is that people tend to isolate a lot. So, and isolation makes it worse. So getting a good support system, have friends, be involved in groups around you, go out with friends, live your life. Because that medication, it will give you your life back. So live the life that you have been given. And also support groups. So support groups like South African Depression and Anxiety Group. You can go on www.SADAG, South African Depression and Anxiety Group, .co.za, and then you will find that there's so many support groups that are there. So this is a space, you can find ones that are online, so virtual. You can find ones in the area that you stay. So these are spaces where you can be with people who also have bipolar, who have a same life experience, and so see, Rocco, that you're not alone. Because I think a lot of times people feel that they are alone.
Yes.
That I'm the only one going through this. Yes. But having those support groups actually helps you understand that you're not alone and you cope with the illness much better and people understand you. Okay, so what I would say to you is that bipolar disorder is a treatable mental disorder. And it might feel very hard in the episodes, but I promise you, with the right team around you, your psychiatrist, your psychologist, you are able to come out in the other side and you are able to live a fulfilling life. And I think what is very important is not to define yourself by the illness, but define yourself by who you are. So you are not bipolar. You are not a bipolar person, but you are someone who has bipolar. You are someone who is managing bipolar disorder, and that just empowers you and makes you feel like you are on top of things, that this illness is not taking you over. You are well informed, you are walking with your team, and your future is always bright.
So there you have it. With proper treatment and support, a person with bipolar disorder can manage their symptoms and lead a fulfilling life. If you are worried about somebody's mental health, do not hesitate to get in touch with a mental health care provider or the LifePath Health helpline at 072 7900 506. Thank you.